Brains Hospital is creating awareness about the prevention of the head injury and related problems. Whenever there is a head injury, whatever may be the cause, when the person is on the road injured, the concept everyone thinks is that the treatment should begin in the hospital. Unfortunately, it is not true. When the person gets a head injury, he becomes unconscious. He will not be able to take care of himself. His breathing can get affected. Blood pressures can fluctuate. There can be bleeding. There can be vomiting. There can be convulsions. And he will remain on the road helplessly. And this is the situation where we need to act immediately. And this care should begin right from the scene of the accident itself. First of all, he might be lying in a dangerous situation amongst the chemicals, glass pieces, sharp objects, electrical wires, etc. Need to be shifted to the safe place. Immediately we need to check his airway, breathing and circulation. We call fundamentals like ABC, which are indicators of the vital functions of the body. And if these vital functions are not stable, that means he is at risk for his own life and need to be shifted urgently to the hospital. And when needs is transferred to the hospital, it needs to be done correctly by a known person in a known method using the right team with an ambulance. So one must dial an ambulance, get the ambulance there to the scene, shift him properly, that is with an assisted transportation. If there is a problem for the airway, breathing and circulation, he needs to be assisted for all these three vital functions so that there is no secondary complications, there is no secondary brain damage, and the person reaches the hospital intact with good vital functions so that the medical team can take over and do that. So this part of the treatment is called pre-hospital care. Believe me, the pre-hospital care is equally important compared to the hospital care. If the pre-hospital care is not given for the length of time that he travels on the road in an ambulance or some other form, without a blood pressure, without a heart rate, without a good circulation, without an oxygenation to the brain, by the time he reaches the hospital, he is almost brain dead. And once the brain damage ensues, there is going to be permanent neurological deficits, which is the one which is going to decide the death as well as the disability of that individual. The hospital may have highly advanced technology, wonderful infrastructure and highly skilled doctors, but still, if primarily the brain is damaged completely, there is nothing we can do with all that efforts that can be ensured in the hospital. So it is mandatory that pre-hospital care is a must, and every individual can participate by knowing the CPR. You can assist the individual by providing the airway, breathing and circulation during the transportation so that he can receive the best of the treatment that is available today.